The patient was very excited about what the bridge looked like, which makes you feel good as a provider. She actually gave me a hug afterwards and was super excited by the results. We were able to get it to look so natural that you would never realize that she has a bridge on those teeth. So we were very excited. My patient presented with a 3-unit anterior bridge that was clinically stable, but she was unhappy with the appearance of the bridge and looking to make aesthetic improvements. I was able to utilize smile analysis and digital treatment planning to learn how to properly evaluate important aspects of a person's smile, like tooth positioning and shape, midline positioning, axial inclinations, and facial relationships, all the things that go into making a smile look more natural. Utilizing this technology, we realized we were going to need the replacement bridge to look a lot different than what she originally had. Through the use of facial analysis, digital treatment planning, provisionalization, and improved communication with the lab, we were able to redesign the bridge restoration for teeth 8, 9, and 10 to not only improve the aesthetics, but also improve the function and overall tooth symmetry. This case taught me that material selection is only a small part of aesthetic dentistry, and that success comes from thoughtful diagnosis and thorough treatment planning.